Hi, my name is Michelle. I was diagnosed with Lyme about 4 years ago. It's believed that I had it long before that, but at that time I basically crashed. I worked at corporate America and I couldn't function, I couldn't really speak correctly, I had a hard time walking, and then I was on the search to figure out what was wrong with me. Fast forward, it was pretty evident through testing that I had Lyme and I had it bad. So off I went on the search to get better, which started with antibiotics, and I thought at first it would be 90 days and I didn't get better, and I did the Herx thing and all of those things. So I took oral antibiotics for about a year, and then I kind of said I can't do that anymore. Then I sort of sat and dealt with my symptoms at the time, and then I got worse and I started to lose the use of my left leg. I really was just exhausted and couldn't think straight, and I couldn't function, and I went from being a very productive person to being in bed all the time. So my next journey took me to a clinic in DC where they put me on 9 months of an IV antibiotic, which I plugged along and did everything I was supposed to do, and I probably got a little better. And then after I got off the IV, they continued to put me on more antibiotics to the point where I got pneumonia. And they told me that I just needed more, and my own instinct said that that's it. I can't take any more antibiotics, and I just stopped everything. And I started searching for other solutions, and my primary care doctor had told me about a place, Lyme Laser Institute, and she said you might want to try it. She too was always trying to find solutions to Lyme. So I came here skeptical, as I've been through the whole process, because I keep being told I'm going to get better and I don't. And I said, well, if I'm going to do this, I found it very reasonable. It was very healthy minded. I got to talk to a lot of other patients, which was the first time I really was in that experience where I would talk to a lot of Lyme patients. Nothing was kept from me. I wasn't isolated. The environment allowed you to learn what other people have been through. So I was very disciplined and did exactly what I was supposed to do, because I thought if I'm going to do this, I have to be dedicated. So that was May 1st, I started this program. It was a little bit, some people, respond really quickly. I took a little longer, but Dr. Wine had told me, given what you've been through, it might take you a little longer in the process. But even my family, my colleagues have said, you're back. It's like your old self. And, I still have some, I would say I'm probably at 85%. I still have some minor joint pain and some fatigue at times, but some of that comes from just managing myself. I get pretty enthusiastic to just jump back into life, so you have to, be realistic about your body healing. But I couldn't encourage you more than to give this a shot. All of you that have dealt with Lyme know that it is a very frustrating journey, and you feel like you're on your own, but you'll be in an environment here where everybody encourages you, everybody's at different phases, and we're all helping each other get better. So if you're thinking about it, at least come and consult with the doctor and see if it's for you.
Did you feel that the protocol that was offered to you and done here was comprehensive? Was it, a lot of places you just go there, like you said, you've been to places where they just give you antibiotics and they never see you again. The doctors, you had told me earlier,
yes,
you went to a doctor and never saw him again.
Yeah, I saw him the first meeting, and then I saw physician assistants the rest of the time. And so you really became part of what I felt like was a production line. I never really got an opportunity to talk to other patients there. It was a very fancy facility. And I'm not saying that the individuals there didn't care, but I think that it didn't feel very focused in from the standpoint of, it felt very much like a protocol, and everybody fit into it, and they would ask you how you felt and you'd write things down, and the answer always was more meds or changing the meds, and yes, there was some diet pieces to it, and there was some natural pieces, but they were very after the fact thinking. And so much of my journey has been about a lot of the world out there has been telling you have to take antibiotics, and actually to the point where they would say, hang in there, you just got to be on them longer, it'll take a good 3 years. And I think my own instinct was that my body was telling me, this is just not okay, I can't take it anymore. And so I listened to myself, thankfully, at that point. And anybody that's going through that, you're just looking for guidance, you're trying to trust somebody out there, and it's a hard journey because you're really not in the best mindset yourself. You're hoping the people around you are helping you because the person you once were that had the aptitude to look into things is too exhausted to even read about it. So you're just sort of trusting, please make me better. I'm a very tenacious person. I'm a very driven person that I will figure it out. I'm not a person that would get on a video and say something without 100% faith and passion in it, because I really know how you feel if you're suffering from Lyme, and I just want people to get better. I mean, I've had a lot of people ask me, how did you get better? And it's just honest. It is what it is. I mean, the results is in the whatever that saying is, the results is in the pudding. I don't know, but I couldn't be happier, and the people around me are enthusiastic that it's like, Michelle's back. I really am getting my life back, and what else is it that you're looking for? Just to get better.
Just look for us.
And there's nothing damaging my body. It's all healthy. It's all, driven. It's the course comes at you from what you're ingesting from a diet standpoint to, detoxing your body to, the physical elements. It really is all inclusive, so that you're not just trying to fix it with a pill. You're really letting your body have the tools it needs to fix itself.
Well, the lasers help a little bit too.
Yes. Yeah. Sorry.
And some other things.
Yeah. Well, the lasers I think are amazing. I don't fully understand them, but I think that the reality is I've done a lot of reading about lasers, and I think that we're going to find more and more that lasers are going to do for us, but they're not really here in this country. Well,
don't feel too separated from that, because there's hardly anybody that knows what lasers are.
No, I know.
Except for, again, we're fortunate here at Lyme
Right.
Laser to have the #1 laser guy in the world in our back pocket.
Yeah.
So along with him and my tenacity to force him to help us, we figured this out. So
Well, some of the reading I've done has talked much more, less about Lyme, but more about muscle repair with lasers.
So that's what the first things that were done were muscle repair. But if they
Right.
can repair muscle, do you think they could do other things as well?
Yes, no,
There you go.
logically it makes sense to me. Oh, no, I think that the thing that, the point I think I would want to make is that the aspects of what you have when you come here is, it's many things together that Dr. Wine has taken the time to figure out over the years to say, okay, this is working. And I guess the difference is they really, really are focused on getting you better. It's not an expensive proposition compared to what I've done in the past, not even close. I think it's very reasonable. For the result is beyond reasonable. I would have paid way more for this given where I am now. But that's not what he's about. He's about, people getting better and focusing in on, each individual. And so I watch him with each patient. I just walked in here and he talks to every patient every time they come. And I think that's important. It's a very passionate, we want to get you better environment. And I've seen all spectrums of people here. And at the end of the day, it's a disease that's taking over, and we need solutions, and everybody needs to get over themselves and figure out how to just help each other out and get better. And so if there's a solution, let it be heard. And if there's anything I can say, just give it a shot. If you're anywhere near here, you should come in and do the assessment.